My name is Dr. Kristie. All right, so good afternoon and welcome to the session on social equity and intersectionality, local government management responses and approaches. I am Dr. Kristie Roberts-Lewis. I'm chair and associate professor of the Departments of Public Policy and Public Administration at Southern University and A&M College. Today we have three presenters, and each presenter will have at least 11 to 12 minutes to present. At the conclusion of each presentation or all the presentations, we will then have time for question and answer. I'm going to take about 1 minute to allow each presenter to introduce themselves, and then we will get started with the presentations. So the first presenter is Brie Haupt. She present?
Hello, everyone. My name is Dr. Brie Haupt.
Haupt.
I know Haupt is German. You have to really like spit at the end if you want to say it right. So I am an assistant professor at Virginia Commonwealth University in the Department of Homeland Security and Emergency Preparedness. My research background focuses on crisis communication, vulnerable, marginalized, underserved populations, as well as cultural competence and community resilience.
Thank you and welcome. Next, we'll have presentations or introductions by Deborah Brockus and Algie R.
Hi, everybody. I'm Dr. Algie R, and I'm co-presenting with Deborah Brockus, who might be in transit right now, so she'll be joining us in a few minutes. But let me introduce her real quick. She's an esteemed Los Angeles dance artist and program guru. She organizes the Los Angeles Dance Festival, a lot of the low-income school programs, and between the Los Angeles area in California and Long Beach area in California. And I myself work right now as a Fuse Core Fellow, Executive Fellow, working with King County Metro in Seattle, Washington, for affordable and equitable transportation access for low-income workers around our region. So I'm happy to be here. Thank you, Kristie.
Thank you. All right, and our last presenter is Arsene Frederic Jr.
That is correct. Hi, hello everyone. My name is Arsene Frederic Jr. I'm a second-year PhD student at the Howard University Higher Education Leadership and Policy Studies. It's a mouthful there. I'm a research fellow with the Association for Public Policy Analysis and Management, and I will be a graduate assistant in the department this upcoming fall.
All right, thank you and welcome. So Dr. Haupt, we will start with your presentation.
Okay. Okay, can you all see the screen?
Yes, we can.
Okay, thank you. So there is some automatically generated captions, but I will say that if they are incorrect, I can always go back and translate for anyone who is hard of hearing or would like those translations. So I'm going to talk today about a research project that my co-author and colleague, Dr. Karen Sweeting at the University of Rhode Island, started putting together. We were really starting to talk about the COVID impact on some of our underserved populations and marginalized populations. And having lived experience as being homeless, we were really interested to see how the local level has been trying to engage homeless populations and or not engaging homeless populations during crisis response. So the role of public administration, we know, has evolved and really is having to confront a lot of contemporary social issues. We know that communities really rely on their local public administrators because not every county or parish has a emergency manager that can assist in this to help effectively communicate before, during, and after a disaster. And we know that this relationship building is vital, especially during crisis response. When you need information fast, you need to know what to do for response and recovery. And then even before crisis occurs, you want to have your local leaders really engaging with our marginalized and underserved populations so that they can build trust. And so that when the information is being disseminated, individuals accept that information and they act accordingly on that information versus questioning it or deciding not to engage in any preparation, mitigation, response, and recovery type activities. And we also know that the homeless population is very unique in its intersection with crisis response, because a lot of our methods rely on digital communication. And if they do not have access to a phone, they are already out of the loop. And a lot of the information is not posted in areas where you'll find usually individuals who are homeless, whether it's tent cities or social services. And also you'll see my cat pop up. I'm sorry about that. She loves to join every single presentation. And she loves talking about vulnerable populations apparently. So we'll just keep it going. One of the big things too is, how do we define homeless? This is a crux actually for me, my opinion, in terms of some of our structures, political, social, economic, that showcases inequalities, is that we have a definition of homeless. So individuals who lack fixed, regular, adequate nighttime residence, who will imminently lose their residence, unaccompanied youth under 25 years of age, or an individual or family who's fleeing or attempting to flee domestic violence. Though this definition that we utilize, and that's been started with the 1977 Stewart B. McKinney Homeless Assistance Act, we think that it's very encompassing. But what happens is that when we use this definition for some of our aid systems, it gets disjointed. So for instance, homeless populations that were homeless prior to a crisis are not eligible for disaster aid. So what happens when those individuals are being impacted and they have no additional resources to assist them, and they're already having challenges accessing resources prior to a crisis? So we talked a little bit about numbers in our project, because we were really trying to first explore what crisis communication methods are being done for homeless populations that are defined, about how our grants and our acts are defining them. And so we found that according to a 2020 report, this does not take into account COVID numbers, by the way. Those numbers have yet to be completely finalized. But we did know that over 580,000 individuals experience homelessness on a single night. And then geographically, half of all those individuals reside in the following 4 states: so California, New York, Florida, and Texas. So having being a native Floridian, that was very upsetting to see. But then I also am very used to it because I was one of them for a while. So we're really interested to see what these specific states were doing when it comes to homeless populations and crisis communication. So some of the disparities that homeless populations face is that there's no access to affordable housing, there's inequity in education and justice systems, wage gap, segregation. You can see the list on here. And a big component too is that we're very stigmatized. Homeless individuals are seen as not being able to do anything, or are often seen as a number and not a human being. They're easily forgotten and easily just dismissed because sometimes it's too hard to engage this population in our response and recovery methods and in preparation mitigation. But what does that say for us at the local level administrators if we refuse to assist just because it's a little harder, and that we need dedicated resources and funding? So when it comes to crisis communication and homelessness, there really is not anything out there that discusses like best practices or whatnot. So I had to just pull from crisis communication literature in terms of what are some basic communication practices, what can we do? And so for emergency management, when we talk about communication during a disaster, we usually talk about before, during, and after. So we have it timelined in phases. Well, some crises do have a before, during, and after. It's very easy timeline. You have a hurricane, it's here for about a few days, it ends, and you can start your recovery procedures. COVID has been a long-term impact crisis, and so we're still not at the end of it. And so what happens when we have complex pandemics going on, or complex crises with cascading and compounding effects, and we're supposed to engage in these populations and be able to communicate. General crisis communication tells you you want partnerships, you want to prepare for the event as much as possible, you listen to the public, you utilize the media and promote the self-efficacy. But some of that just cannot be done with certain populations. And so we need to be able to address that. So we did look at California and New York as kind of the main states we focused on, and then COVID as its own case study. And so we were looking at what some of these local levels do, because California leads the charge, unfortunately, and the amount of individuals who are homeless, and LA County specifically has the highest number. They have had some initiatives, and they did create this whole person care model, which also connects with FEMA's whole community approach, Federal Emergency Management Agency's whole community approach, that says that you need to engage all actors and all stakeholders. With homeless individuals, they're saying for this whole person care model, you need to engage the entire person. So not just focus on just their housing situation. What is their health situation? What's their job situation? Be able to look at them as the actual person versus just a number in a shelter, if they even have access to a shelter. They did create a crisis and incident response or community-led engagement initiative. This is probably the one that's still currently in place. And so just saying that if a crisis occurs, they have an outreach team. The unfortunate thing is that they have started other initiatives in the past, but because of funding and because of a lack of staffing and a lack of local administrator buy-in and support, the initiatives have fallen off. And so what does that say to when we're trying to create programs and services? And then all of a sudden they dissipate. And then there's no communication about the fact they ended. New York, in early 2020, New York is said to have one of the highest rates of homelessness. Again, the numbers have yet to be completely calculated for how COVID has impacted these numbers. But they did create for New York City a homeless outreach and mobile engagement street action teams. So those, similar to the one in California, is to say that when a crisis occurs, there's individuals, oh, someone is not muted. There are individuals who go into tent cities and so forth and be able to communicate about the crisis and what to do. And then we did the COVID pandemic. We knew with the COVID pandemic that the numbers are still being calculated, that the impact was devastating. And one of the most interesting aspects is the fact that if you were homeless because of COVID, or you were soon to be homeless, that you were eligible for aid. If you were already homeless, you were not. And so again, we're seeing that even during a large scale crisis, this population is at a disadvantage. And that's not necessarily okay. So some of the major themes that we found during our study was that coordination and collaboration is necessary. They talked about it, but it was always done on the local level. The state and federal did not really get involved unless an organization like one of these outreach programs had a grant. So what does that say when we kind of need the whole system to be involved and there's really not a lot going on? There is this need for informal networks. We can formalize a lot of our communication processes, but a lot of it revolves around finding community leaders, like leaders in the tent cities and so forth, to be able to communicate with us informally even about the issue, because sometimes formal networks can be more stigmatizing for the population and they choose not to engage. Trust has historically been an issue with local administrators and those who are considered homeless, especially with the stigma. When you have certain populations that decide that they don't want anyone who even looks homeless to be in their area because it lowers property values, et cetera. We're having to battle against that. And so that breaks a lot of trust. And even with law enforcement or healthcare workers, the trust isn't always there because of the stigmas that surround being homeless and what a homeless person should look like or what they're going to act like or what they do and do not do. We also looked at organizational individual access to informational resources. We found that really the best place is in our social service offices. So not only do you want to have outreach teams that can identify shelters and tent cities, because not everyone is eligible for sheltering, but you also want to have information at your social services areas because of the fact that they'll still utilize healthcare, they'll still utilize hospitals, et cetera. So that can be a main hub for some of our communication. And the last few themes was you need targeted communication efforts, especially ones that kind of connecting a little bit further down, but focus and non-stigma messaging. Again, individuals who are homeless, they are not completely inadequate human beings. They are able to assist, they are able to help. Some of them can be very self-sufficient. Some may need additional resources, just like any group. And so the stigma is really the biggest thing that we're kind of fighting against. And the fact that they're never brought to the table when we talk about crisis communication outreach and methods and what works. Relying just on digital doesn't help when you don't have access to a phone. Mail outs doesn't help when you don't have an address. So how can we circumvent these different barriers, or what we have preconceived notions of? These are best practices, we must do this, but those best practices are not going to reach the population. So what can we do? How can we think out of the box? Having a dedicated crisis communication team can also assist in having the same people and having them build relationships is very vital. And then inclusion, again, in the planning efforts on how we can communicate, how we can find resources, dedicated resources to help individuals and hopefully reducing stigma around this population during the crisis. So that was our study, very quickly done, hopefully. I will be available for questions, obviously, and I think we'll probably take questions at the end if we do have time. But I want to thank you so much for listening.
Thank you for that great presentation around homelessness. Dr. I, are you all ready for your presentation? Okay, please proceed.
I'm going to share this and let me know if you can all see it.
Yes.
Yes.
Okay, so again, as I mentioned, I'm Dr. Algie, joined with Deborah Brockus here, and we're going to take you on a journey regarding transportation access, public transportation access in specific, and the impact of performing arts education in under-resourced communities, marginalized communities. And so some of the things about public transit that we know, most of us know, and there's a previous session about this as well, are there individual benefits. There are, the mobility, the individual mobility, the safeguarding our mobility independence, right, for anything, any kind of life events. And then we can gain social upward mobility in an aspect, promoting health, lifestyle healthiness and well-being. There's also certain environmental benefits for us, right? We can reduce greenhouse gases, conserve energy, reduce road congestion, all that good stuff. But what we want to really focus on also is the social economic benefits, right? Transit usually have a way of better promoting land use, and it can create job opportunities, investment opportunities, and also promoting connectivity, and therefore then reducing inequality, right? And how does that tie in with people moving, and specifically in dance? So some of the things that we know as we move is health promotion, right? It's good for us. We move around, we stand around, we enjoy the music. There's also a mental health aspect to it. Dance can minimize depression, reduce stress for us individually, and it can also promote socialization, right? A lot of the dance aspect of it are for socialization, and it's that allowing us as an individual and in a group to get into that connectivity of within ourselves, having that inner experience and being creative, and then have that outer experience being, connecting to other people. And also there is a historical cultural aspects to dance. So, humans use dance in history to tell stories, right? To pay tribute to nature, to talk about thoughts and emotions, to talk about mythology. So all of that, having access to dance education enriches our lives in many ways that a lot of times we don't realize. So moving, just in general in public transit, moving as in dancing in general, we want to take you to take a look at travel journeys of students, and we'll roll into Deborah Brockus' case studies of how her dance education program had benefited these students. And so what you're seeing here is a map on one side, and like I mentioned before, Brockus Dance Studio is located in Los Angeles, and there's a high school that her program serves is the Renaissance High School located down in the Long Beach area. So this is kind of a map of how that journey goes. It's a hike, right? For a West Coaster, that's a hike, 24 and something miles. These are high schoolers. So on the histograms, the shorter graphs are showing that if these high schoolers travel from their high school to and back to the studios and they're by car, the shorter bars. The longer bars are the public transit time, right, per minute. And so you can tell right away that's doubling the time. And we talked about it in our early session, right? We heard that, usually public transit is not serving because there's time consuming. It's not that people don't want to do this, they do, but it's so much time consuming. Now, one of the things that when I work in Seattle region with the King County Metro Transit Agency, and one of their interns did a little bit of research and discovered youth found the barriers for them is not so much just time, but it's also the fear or the perception of physical safety on transit, which is a big thing. And then not really knowing, the second thing is not really knowing how to access it. So we're talking about high school or youth, right? And this journey is about middle school. So middle schooler, you're even younger, you cannot drive yet. And so now if you're doing that journey, and this particular middle school is a little closer to Brockus Studio, which is, I said only about 8 miles, but it's still quite a distance. Same graph that you see, right? Travel by cars, shorter time frame, travel by transit, a much longer time needed. Now, I failed to mention earlier, both of these schools, if a students were to travel by transit, they will need at least one transfer, and they'll need at least about half a mile of walking distance from their transit station to the site, right? Whether it's their high school or the studio. So why do we do these mapping? Because if imagine this world with public transit access takes less time, is perceived and actually is safe, imagine what we can do, right? So now I'm going to introduce you to Brockus Ed, her program and what she can showcase. So go ahead, Brockus.
So my name is Deborah Brockus. I founded Brockus Project Dance Company in 1994. We do a lot of work with students as well as the Performing Arts Company. And the kids that we work with are K through 12. They're in Long Beach and Los Angeles. They come from very poor income areas, and they have a very restricted amount of dance in their lives. We are normally the only dance they've had. They've had as the teachers, and the administrators and the parents have such great comments. The kids' academic scores go up, their discipline and social emotional ratings improve dramatically. It's a wonderful thing. They love having us. The problem is we can't always be in their neighborhoods, and their neighborhoods cannot help us in terms of space. So we try to bring them to our space. We've had so many students that have wanted to come, and because of transit, they cannot really go alone through some of the dangerous areas. And we've had kids that tried to put together carpools and they had to drop out of the program. So we're not able to help impact so many of these students get better lives and be able to express themselves and find some joy and possibly even some careers in the arts. So we need some better transit for the students.
Thank you, Deborah. And I want to highlight one thing that her program also served. These are the population that served during the pre-pandemic time and the pandemic during right now, the pandemic time. So as you can see, there's a lot of various groups, and they're located, like she mentioned, the Los Angeles and the Long Beach region. And a lot of them are median family income is extremely low. So a lot of times you might, have students that really want to participate in these professional dance trainings, but yet cannot get to the location, right? And the setting that is mentioned by Deborah is the idea of putting the learners into the professional setting gives them a different aspect of perspectives, allowing them to see, this is what's happening. It's really eye-opening. And thank you for sharing that, Deborah. And so what we want you all to think about as we, tying in mobility of people and mobility of public transit is, how would you join this movement? How would you bring light into the situation? How is it that we're transporting your learners, right? How are they coming to your class? How are they showing up? And what kind of actions do you think can get involved? And we're happy to open the floor for comments and ideas. And this is our contact, and feel free to connect with us, ask us questions after this. And we thank you for your time.
Thank you. And thank you for that wonderful presentation on social and economic mobility. Our final presenter this afternoon, or morning for some, will be from Mr. Arsene Frederic Jr.
Hello, everyone. Are you able to hear me and see my presentation on the screen?
I might need to stop sharing, which I'm not able to do right now.
Okay, are you both? Yeah, I still see Dr. Oz screen.
Yeah.
So can you
help
stop
me?
sharing,
Oh, here we go.
Mr.
There we go.
Frederic? There we go. Okay, now you should be able to share.
All right, everyone. Are you able to see my presentation on the screen?
Yes, we can see
Okay,
it now.
perfect. All
Okay.
right. Well, thank you all for having me here at this conference. It feels good to be on the panel with scholars and practitioners focused on equity in various contexts. And so again, I'm Arsene Frederic Jr., a second-year PhD student in the Howard University Higher Education Leadership and Policy Studies program. So my presentation today is entitled Exploring Intersectionality at a Minority Serving Institution, a case study of campus equity plan. I just want to note something here, error on the phrase plans and submission, and that the presentation is only focused on one equity plan, so it's just singular. I know the session says plans, but it's just one plan. And so I held a virtual interview with the Director of Diversity, Equity, and Inclusion at Gulch University. It's a pseudonym. So this interview was held to examine the institutional campus equity plan, and it was approximately for 55 minutes. And so this research examines the efforts of the Director of DEI at Gulch University to meet the diverse needs of their students and stakeholders. So this is qualitative research. And so I use a pseudonym to conceal the identity and the location of the institution. The research itself was conducted in 2021. And so this data essentially reflects the 2020-2021 academic school year. And here are some notable data points of Gulch University. And so this campus equity plan is an initiative from the university president. It is a public institution located in the South Atlantic. It is the largest MSI in the region. So MSI stands for Minority Serving Institution, and it's also the largest HSI in the region. So HSI stands for Hispanic Serving Institution. It enrolls about 46,000 students, both undergrad and graduate, 61% Hispanic or Latino, 13% Black, 15% white, 4% Asian or Pacific Islander, and 7% other minority groups. And it is an R1 research institution. So here's an overview of my research methodology. And so this is a semi-structured interview. And I'm essentially using intersectionality theory to inform the interview questions. My sample is purposive, meaning that I intentionally sought out this personnel to interview for this research here. My positionality is I'm a Black male working in policy and research with scholarly interests focused on minority serving institutions, but I have not worked or attended at a Hispanic serving institution. And some limitations is that this is one HSI, and it tells details about its campus equity plans, meaning that it's not generalizable, but there are some best practices and recommendations, and we'll get to those in just a moment. So often minorities have layered identities, and the most salient identity is used for data capturing purposes. So intersectionality allows us to examine the implications of layered identities. So according to BOLEG 2008, it states, rather than an additive approach that frames multiple identities as isolated and resulting in summative inequities, an intersectional approach allows for a focus on how interreliant socio-historical systems influence interdependent identity-specific experiences. All right, so I'm just going out here. So I recognize that we're now in 2022, but I wanted to share just a brief video from the Independent to remind us on the urgency of equity in our society, specifically on college campuses across the United States. So I'm going to go ahead and share my screen. And let's see here. Oh, wait, let me bring it up. All right.
Mr. Frederic, we can't hear your video.
Oh, I'm sorry. Did I hear we can't hear the video?
Yes, sir. We can't hear the video.
Oh my gosh. Okay. All right, let's see here. I didn't click share sound. And I'll just show just about 10 seconds of it because I just want to move on for time purposes. Okay, let's see here. Okay, let's see. How about now? All right. And so again, as I mentioned, I just wanted to essentially share that to essentially remind us of the urgency that a lot of sectors in our society felt when it came to diversity, equity, inclusion, specifically college and universities in the United States. And so we can essentially move along. And so the video broadly highlighted the equity-centered calls for action from our leaders across various sectors. So 1 year after the George Floyd protests, the National Association of Diversity Officers in Higher Education, and NASPA, essentially conducted a study of campus equity efforts through their statements. And so here are their findings. Among the many findings, what I found to be notable are the second and fourth bullets. And so the second bullet essentially states, predominantly white institutions and minority serving institutions issued statements, so campus equity efforts, statements at similar rates. And so the report showed that they included different statements. Also, the fourth bullet here says that minority serving institutions were more likely to mention structural inequality or racism and discrimination against Black and or African American people. And so this is essentially the sort of guiding framework or the sort of guiding analysis that is being included in this research as it relates to analyzing campus equity efforts at a minority serving institution located in the South Atlantic region. And so this statement here is pulled directly from the campus equity plan. This plan combines interviews from personnel across Gulch University. So it's combining interviews with deans, faculty, staff, students, alumni, retirees, members of the business community, to essentially review the university practices, procedures, data points, best practices that are all associated with the related research at the university. And so strictly for presentation purposes, here are some elements pulled from the campus equity plan. And so what we can note here is that here we have the proposal section subheadings. And so this is essentially included in the campus equity plan. And it's pretty much including some elements that through the interviews, as I mentioned, with the deans and pretty much university stakeholders and personnel that they sought to essentially reform at the university and the institution. And then here is a new organizational structure proposed in the Campus Equity Initiative. And so you have the university president and then the Office of the Vice Provost for Diversity, Equity, and Inclusion. You have all the diversity programs to fall under it. Here's some data around administration and staff, ethnicity, race, and demographics from 2020. Just want to give you a chance to view that. All right, and then also here are some faculty, ethnicity, race, rate, and race demographic data in 2020. It's important to note that there are no points that specifically mention intersectionality or it looks at layered identities, and also this information is self-reported. So this research essentially seeks to explore the extent to which intersectionality is integrated into the campus equity plan through the perspective of the Director of Diversity, Equity, and Inclusion, who is also the Equity Officer and the Affirmative Action Officer for the university. And so here are some broad themes about defining Blackness, decision-making, and reform from the interview findings. And so when essentially asked the question about how does it use the campus equity plan, use an intersectional approach to include Black women, especially around tenure, the response pretty much was, as it relates to the legal ramifications, so thinking about it from the affirmative action perspective, that is pretty much where we begin to think about intersectionality or any approaches around thinking about it from an intersectional lens, there aren't really any much efforts past that. So we can see that evidently at the top left and the bottom left in the question that essentially stated, is there a group responsible for disaggregating data on the broad identity of Black? Ultimately, we understood that there was no group for disaggregating data. So again, we looked at data for faculty and staff who have, and how the data is essentially collected. It looks at it, for example, for someone being Black, for someone being Hispanic, for someone being Asian or white, but it's not necessarily looking at someone who may be Afro-Latino, for example, or for someone who may have, again, as I mentioned, layered identities. There's also a question around, responsible for disaggregating data. So this is the same question, but here's a different perspective. It also was revealing to learn that in this region, knowing that Govt University is a Hispanic serving institution, there's also underrepresentation for Hispanic faculty who are on the tenure line as well. So this is a really interesting interview, especially considering, again, as I mentioned to you, this is a minority serving institution, it's an HSI, it's located in an extremely diverse region. And you're beginning, we're really analyzing based upon the campus equity plan that there's more work to do as it relates to diversity and inclusion. And so as we think about pretty much stepping into the future, Govt University is an R1 institution, right? And so we know that R1 institutions foster critical research for local communities, especially when it comes to forming partnerships. So even for MSIs, it's important to think about equity and how personnel experience policies and practices when they have layered identities. There are also a series of partnerships that Govt University have with nonprofit foundations and local government. And so by focusing on intersectionality, there will be an intentional equity-focused approach that allows a broader array of research topics to be covered and issues to be addressed in the local community. So one of the solutions that I am proposing here is that to institutionalize the process of this aggregation, as we can see, as mentioned here, there is some sort of aim of this aggregation or some sort of approach to integrate intersectionality, but it's happening in silos. It's not happening at a institutionalized or as an institutional-wide vantage point, especially considering that they now have a new position of Vice Provost for Diversity, Equity, and Inclusion. So, you can use this to build on the structures in place. Also, we could think about how students who experience the racial microaggressions to examine their perceptions. And so when data is essentially being collected, think about, again, as I mentioned, for students who may be Afro-Latino or for students who may be Hispanic and bear a Hispanic identity or bear an Asian identity or bear a Hispanic identity and a white identity, allowing those categories to be included in their surveys to examine the perceptions of the students and therefore identify curriculums or programs that have a deficit lens and to alter or modify those programs and curriculum to have an asset-based lens. So when we think about deficit is essentially a concept where you're not defining the category of someone's identity or defining a group based upon their worst experiences or based upon the deficit of their identity, but through the best asset, through the best experiences or through the best concepts of their identity, and allowing students, faculty, staff, and stakeholders to really flourish in that regard. So that is my research. Thank you all for joining me in this presentation, and I'm happy to answer any questions.
Thank you so much, Mr. Frederic, for that presentation. Now we'll open the floor for question and answer from any of our three presenters. Do you have any burning questions from the audience? Okay, well, I jotted down some questions. I'll start with you first, Mr. Frederic. In terms of how you operationalize the term intersectionality in your research, can you give us greater context there?
Absolutely. So there is a a wide array of sort of documents that I was essentially pulling from. I mean, of course, there's the functional definition of intersectionality, as mentioned by Zambrana and a couple of the authors that was listed in the research that I presented, but also thinking about it from the context of the document as it relates to looking at campus equity statements from NASPA. And so beginning to think about, for individuals that have layered identities, how are they experiencing these policies and practices across the university? So one of the tools that I essentially used in the interview was this tool developed by the Chronicle of Higher Education, and it was released in 2021. And it pretty much revealed, this is self-reported data, by the way, how many Black women have tenure across the United States. And so we're using intersectionality to think about, when you're cultivating the campus equity plan, or when you're cultivating the campus equity efforts, are there any type of groups or any type of personnel who are intentionally thinking about how this is going to affect a group such as, or identity such, for someone who has a group as a Black woman? Or in another example, for someone who may have layered identities as I mentioned, Afro-Latino, or for someone who may bear an identity as, for example, white and Black, or because these have real world implications in terms of where people may be from, in terms of their socioeconomic status. Again, as I mentioned, the South Atlantic region is a very diverse region. Govt University is the largest MSI, also the largest HSI, especially considering the status of them being an R1 institution. This has far-reaching effects for who they're attracting, but also what they're able to continue to give into their region. And so this is how I'm defining intersectionality.
Okay. And I just wonder if your work, did you cite that you were using Kimberly Crenshaw's work?
Yes.
Okay.
I cited that I was using Kimberly Crenshaw's work as well. I actually forgot to include that citation, but in the full work, in the full paper, that citation is there, yes.
Okay, yes, because her work has been groundbreaking in that regard, where she's talking about the multiple identity categories. So I know that that could be useful. And so thank you so much for your presentation. In what ways do you think this notion of social equity, and in terms of outcomes and implications of your research, how would you perceive the intersectionality in some ways with this notion of social equity among the university that is at the center of your research?
Right. So just thinking about, this conversation, this is an initiative that came from, in terms of the campus equity plan, this is an initiative that came from the president's office. And so it wasn't as, I guess you could say, revealed, but there were some stakeholders, a part of the university community, that pushed back. And some would say that's surprising, considering that, again, it's a minority survey institution. It's also a Hispanic survey institution. And so I think because you have this kind of push and pull force, the degree to which you can think about equity, there's already some sort of tension there. And to take it a step further, to think about intersectionality, it does present a challenge. I think that's kind of, through the interview, what I was sort of finding, especially when we think about a position being created specifically for diversity, equity, and inclusion, a vice provost. And I interviewed the director of diversity, equity, and inclusion that works in that office. And so to know that, these are individuals who have years of experience in this realm. And again, the diversity, equity, inclusion personnel also serves as the equity officer and the affirmative action officer. And so, they know their stuff, right? And so to think about how it's intersectionality is not institutionalized from a broad perspective, or not really mentioned in the plan, I think, there's more work to be done. There are some challenges that are there, but as mentioned in the interview, this was a specific snapshot in time. So that's not to say that there's, they don't recognize that there's work to do, or they don't recognize that, there's room to grow, and, that they're not doing it. And to add on to that, they actually have this university, and I'm going to continue this research, they actually have, I guess you could say, some sort of marker that indicates from the plan, this is what we have accomplished, this is what we're working on, and this is, in progress, if that makes sense. And being able Right. This is really good. So being able to think about that intersectionality, I haven't seen it there just yet, but I presume that it is, considering not only this interview, but also all of the efforts, it is underway.
All right, thank you.
Of course.
Dr. Haupt?
Yeah. So no, this conversation is really making me think of another conversation I had recently about how with equity initiatives, if you define it, then you also have to be able to measure it and you have to be accountable to it. And so I find that a lot of these equity initiatives, and in Virginia right now, we can't really use the term equity. Don't even get me started on that one. But it's this idea of intersectionality presents a complex nature. And so it's this idea of how do we define it? How do we hold it accountable? In emergency management too, we're even looking at how FEMA's definition of equity is very basic and it's done strategically, because how can you keep a federal organization accountable to something if they have a loose definition? So anything can be considered an equity initiative if you really can't define it as strategically enough and be able to put like your money where your mouth is, kind of thing. So very interesting conversation going on.
Yes, thank you. Thank you for those points. Mr. Peter, do you have a comment or would you like to ask a question?
Yes. Mine is a question to all our panelists and maybe to our colleagues in the audience. In public administration, we typically get caught up with the micro analysis of equity, diversity, equity, and inclusion. We are typically interested in defining, operationalizing, and trying to deal with issues of policy management and organization management and so on. But I think if we think about it very carefully, these issues transcend organizations. They transcend institutions. They are structural problems. And so we really need to develop research that is looking at equity, diversity, and inclusion in the broader context of strategy for governing. And I think this is where the field needs to be moving. And there's some research that is showing that the field actually needs to be moving in the direction of the kind of strategy for governing that transcends organization, transcends policy management, and stuff like that. I wonder, whether our panelists, whether they have any thoughts about this, and whether their research, can consider some of the structural components of diversity, equity, and inclusion. Thank you.
Thank you. Go ahead.
Yeah, I do have a comment. So I have a slightly pessimistic view when it comes to this, because structural change takes a lot of time. And again, you have to be accountable to it. You have to have dedicated funding. You have to have dedicated staff who has been trained. You have to have buy-in from all of your community stakeholders. And we've seen just since 2020 alone, that the historic inequities in our system are only being made apparent to some people just now, which confounds me. But the fact that they didn't see these things before, so we're having to really change ideology and philosophy and utilize facts to support our storytelling and our narrative. So I'm very pessimistic that change is going to happen anytime soon, but I do think that we need to start figuring out and deconstructing our systems to find out where change can take place now, because you have to start somewhere, right? So that's even like my thing with FEMA. Give me a definition of equity that's measurable. Give me something that's managed that I can implement, because if all it is just an ideology, that's not going to help the people who are boots on the ground. I need you to take this and create strategy from it, like you were saying. So yeah, I have a pessimistic, I love the idea of change. I can get I love these conversations, rejuvenates my soul. And then I walk outside my door and I'm like, hello, in a quality world that's not changing fast enough for me, but what can I do for myself, at least now?
Okay, all right.
And I think I would like to echo that a bit. I am also thinking of that a lot of times where, structural changes take such a long time, right? But at the same time, I want to hit back into the education arena. As a previous educator, I think we need to transform our education. We've been following that industrial education model for such a long time, put students into the group that we think they belong, not because they can actually have the capacity to do certain things. So I think that is an aspect of, a way of changing in education, all our educators here and our partners here that can do, push the schools to change, push yourself to change, be the change agent that may not fall under the preferable, be the outlier, be the ones that, who someone questions and say, well, why are you doing this? Or what is the point of, getting the students ahead of the game? Because in reality, we're limiting ourselves, right? We put students in an age bracket and say, hey, you are in this age group, therefore you're excelling only in this age group. And then there are times when we hear like, oh, look at this prodigy. Well, everybody can be a prodigy. And I think if we're given the opportunity, and I think with Deborah and I, we thought about, well, if everybody's given an opportunity, everybody can move. We have in Seattle, we have companies that have physically disabled dancers. We have, blind dancers that can be dancing. And so that movement of that opportunity is there for them. Without that, I think would be really, really difficult for someone to excel. And I think from that point, with that lens, if educators and partners can start thinking about how we can change things, and that will shed the positive light. That will cap the negative, voices in our heads.
And to go off of that too, something I always tell my students is you need to become comfortable with being uncomfortable. You need to stretch yourself, and it's okay to be in that discomfort space and to engage in opportunities that others may question why. I was the first white female in a residential life department at a historically Black college or university. And so I had people looking at me sideways saying like, well, why'd you do that? I'm like, because I like the job, the roles, the responsibilities. I don't see why not. And so that idea of, yes, it may be uncomfortable because I'm the only white chick in this room, but it also is an opportunity for me to stretch and for me to look at things. And then for me to also question people who question me. Why is it such a weird thing for me to want to work at an HBCU? I don't see an issue with that. So what's your past like? Where are you deciding not to be? Why can't you push past your boundaries a little bit and open up that space of conversation? So I agree. Education is a place that we really need to have these spaces and safe spaces to have these conversations as well. I'm finding that some educational institutions, they're no longer being safe spaces for these conversations. And that's, to me, is a heartbreak as someone who loves to learn and who loves to have these conversations. It's heartbreaking to know that there are some students who cannot be themselves and who cannot talk about these things. And even in Virginia, we're not supposed to talk about critical race theory. Like, well, screw you, administration, I'm still gonna do it. And if you fire me, I'll just go somewhere else. It's fine, I'm good. But yeah, we do. Education really provides avenues.
Yes, and I just wanted to spring point off that and say, one thing that I found to be really, I guess you could say, compelling is, and when it comes to the commitment level and it comes to actions, as it relates to the research that I've done on Govt University, is the tool to help folks understand where they are along the way, right? Because, all these beautiful things can be communicated in the campus equity plan or in a statement. And here we are in 2022. I know that there are a lot of stakeholders and personnel who are really interested, and students, and the list continues, who are really interested in understanding, well, where are you now? When we think about governing, there may, there can possibly be another incident that arises or another situation. And so to help folks understand that, we've responded to the past instances and we're building upon those instances, that is a good strategy when we think about it in terms of like long-term, especially when we think about institutionalizing it in the context of governing. But there's always more work to be done. And I do share this sort of level of pessimism, because when we think about, for example, higher education, unfortunately, underfunding, especially when we think about MSIs, is a really big issue among so many other things around balancing competing priorities and interests. So being able to help your community, your audience, and stakeholders understand through some sort of digital tools or through some sort of publicly available data that there is a commitment to, these efforts, and probably have a spokesperson or someone that's continuously communicating with them, because sometimes, sometimes, not all the time, the data sort of can be kind of skewed, if that makes sense. And so giving a person, an actual tangible person that they can communicate with, to say that, okay, yes, y'all are holding yourselves accountable and holding your feet to the fire as it relates to DEI efforts and equity. I find that that's a really good sort of approach, a really sort of good take. But as always, it takes taking a step back and allowing these strategies to play out.
All right, thank you. Are there any additional questions from the audience? We have time for one or two more questions. Go ahead, Jamie.
Hey, everybody. I just wanted to, it's a really interesting kind of dialogue and interesting discussion. I think kind of the gist that I'm getting out of it is a lot of people here, obviously we're here because we think equity is important. We think, equity needs to improve across the board in the public sector, but especially I think in academics, we're all kind of in agreement on that. And I think the responsibility that we have kind of as just public sector leaders or leaders in education or just kind of actors in this public sector is to be convincing, right? And I know there's a lot of like discouraging dialogue or a lot of like discouraging verbiage of like, well, don't talk about this and don't say that. And there's like preemptive silencing, right? when this subject even comes up. But I think our responsibility as public sector kind of administrators or public figures, whether that's in an educational setting or outside of that, is to kind of come with this, speak their language, right? So have qualitative data, tangible examples of like barriers to success, barriers to like program success, program outcomes, like for example, the individuals who cannot transport themselves to the dance classes, right? Or how does barriers to success differ from like a Hispanic student versus like an Asian student versus a Black student, or an Asian student who identifies more with the Hispanic side or vice versa, or what have you. So just having very tangible examples of how those barriers play a role in an educational process or in any process for that matter in the public sector, and then how to bridge those gaps, those opportunity gaps for those individuals or for those groups, those social groups. So it is kind of a responsibility on our end to be more specific, be more direct and more convincing, I think, and it's tough, right? Because we're discouraged because it's like, yeah, for the non-believer, no proof is enough, right? But that's why we do research. That's why we kind of address these issues or try to address them via research and have tangible examples of how we can bridge those gaps and make education specifically more equitable to society, to the public as a whole.
Mm-hmm. And Jamie, really quickly on your thing too, because I know we're about to close this. I think also it's the basic need for human connection and having someone listen and understand and validate you, whether it's you as the marginalized population or you as the majority philosophy, whatever that is. So I definitely agree with you to have facts and figures, but then also mixing that with storytelling and narratives to get the two sides for sure. Great point.
I agree. Yeah, it's a balance because we don't want to sound too anecdotal, right? With like very little evidence, nor do we want to sound too administrative and say, well, there is still a human aspect. There is still like a storytelling aspect to it. I agree.
And the involvement of community is super helpful. You're hearing their story. I think that storytelling from us is different than storytelling from them, that particular group that's being affected. So thank you for sharing that.
Yes. So I would like to take this time to thank all of our presenters who have done an outstanding job on today. I'm not sure if you've been following the thread in the chat, but Dr. Haupt, you have a little following, and I will concur with a lot of the sentiments that you hear in the undertones of your research. And I want to encourage you that, yes, you may be working in a space where change is certainly necessary and important. It may be slow coming, but any effective change has always been long-term and sustained.
Welcome back.
Mm-hmm. Dr. Cecil, do you want to do the sponsors now and then still have me do it at the opening session tomorrow?
Absolutely. We just want to take this opportunity once again to thank our generous sponsors who without their support, this conference would not be possible. Starting first with the University of San Francisco Massagon School, Graduate School Management. Also the China Business Studies Initiative at USF, the Leo McCarthy Center for Public Service and the Common Good, the USF Institute for Nonviolence and Social Justice, as well as our institutional sponsors, California State University, Monterey Bay, Grant Thornton, University of Delaware, Biden School of Public Policy and Administration, North Carolina State University School of Public and International Affairs, Rutgers University of Public Affairs and Administration, Newark, the University of Southern California Sol Price School of Public Policy, the University of Connecticut School of Public Policy, the Cleveland State University Levin School, Old Dominion University, the ASPA South Florida chapter, which is the American Society for Public Administration, as well as the ASPA section on democracy and social justice, and the LGBTQ section. We'd also like to acknowledge Virginia Commonwealth University, NASPA, the Network of Schools of Public Affairs Administration, Keene University, the Historical Black Colleges and Universities Northern California Alumni Association Coalition, IAP, Rutledge Taylor and Francis Group, Florida International University School of International and Public Affairs, and the Maurice Ferre Institute for Civic Leadership. And last but not least, the University of Illinois Springfield School of Public Management and Policy. Please join me in thanking them and acknowledging them for their support. Back to you, Dr. Johnson.
Thank you, Dr. C. That was great, and we certainly do thank our sponsors and individual donors, and we will again acknowledge them during our opening session on tomorrow at 8:30. But for now, I think the schedule calls for a break, right, Dr. C? And then we'll come back and have a very exciting plenary session with the China investments in global economies in turbulent times.
Yeah, and that that special plenary session will be opening up in just a few minutes in the breakout room. In the meantime, we hope that you will enjoy this video from Napa.
Thank you, Dr. C. You're a natural at this stuff.
We defeated tyranny in 2 world wars and put a man on the moon. Now we want to apply American ingenuity to make our government work and work for all by addressing the grand challenges in public administration. In a world of complex global networks, technologies, and markets, no single government agency can fix government programs. These governance and management challenges can seem mundane, but they eat away at the roots of our democracy and society. America needs effective approaches to help our government solve complicated problems and deliver better results. The National Academy of Public Administration, established in 1967 and chartered by Congress in 1984,